I am currently a student at Cape Fear Community College, and my goal is to obtain my associate's degree in dental hygiene. So a lot of people already have an idea of what dental hygienists do, but in a sense there is a misunderstanding that dental hygienists are just responsible for cleaning teeth, which they are, but at the same time they're responsible for the entire mouth. So they need to know if there's any underlying gum disease or any cavities going on. The main difference between a dental assistant and a dental hygienist is that a dental assistant has to work under the supervision of a dentist, and the dental hygienist works more independently, which is why I chose to go into this field. Okay, so the reason why I chose this field is because I've always wanted to go into the medical field. And so I wanted to go into the medical field because I love being able to help people, and I love being able to make people feel better about themselves. So I feel like this is the perfect career for me to help people feel better about their smile. I'm just going to go over a couple tools with you. So one of the most important is a scaler. So a scaler is used to clean the teeth and take off majority of the plaque, but sometimes these tools do miss some of the plaque, which is why there's radiographs. So the radiographs show where there might have been missed plaque, or there might be small cavities, or maybe something else that a dental hygienist might have not seen during the cleaning. Okay, so a probe translates to explore. So the probe is the first tool that's used by a dental hygienist during your cleaning, and they are used to explore the mouth and see if there's any cavities going on. Thankfully in this career there's many options of what I could do with my degree. Some of these do require a bachelor's degree, but with dental hygiene it just requires an associate's degree. So the first one I'm going to talk about is a clinician. And all hygienists start out as a clinician in a dentist office. It just gives the hygienist their foot in the door and allows them to have an understanding of how that specific office works, and gives them an idea of what they're going to be doing there. As an educator, there's many different options, but as for me, as a dental hygienist, I will always be educating my patients on how to treat their teeth at home, how to brush their teeth and floss their teeth, what foods they need to eat, and what foods to avoid, good stuff like that, no sodas. But you can also go back to get your bachelor's degree in education for preschool, middle schools, and high schools, and also at colleges or university or community colleges. So a researcher is pretty much the backbone of dentist offices. They're responsible for improving the dental hygiene career. They are constantly researching new diseases, foods that will help or worsen your oral health, or finding new diseases as well. So just a couple fun facts. The average person spends about 40 days in their lifetime brushing their teeth. People who drink multiple glasses of soda daily suffer from tooth loss, and they have 62% more plaque than the average person. And there are over 300 kinds of bacteria that make up plaque. The first dentist was in 1866, and her name was Lucy Beeman Hobbs. The first dental hygienist was in 1905, and her name was Irene Newman. And the first toothbrushes used were twigs, which is pretty interesting. And here's a picture of Lucy Beeman Hobbs, who was the first dentist. And this is Irene Newman, who was the first dental hygienist. this is my works cited page. Thank you.